Hello, everyone. I'm Jennifer Jackson, owner and publisher of Springfield Business Journal, and it's my privilege today to host this webcast on flattening the curve of the COVID-19 mental health crisis. Before I introduce our primary presenter today, I want to take you through a couple of housekeeping items. One is, I'd like to invite you to ask questions during today's webcast. If you'll use the Q&A feature that you can see if you hover over the bottom bar of your screen. I want to let you know that the chat feature has been disabled for the webcast, but you can submit your questions via Q&A. I will see and collect those and then pose as many as possible to our presenter at the end of the webcast before we conclude at 2:45. So with that, I would like to welcome our presenter today, Dr. CJ Davis. Hi there, CJ, how are you?
Hi, how are you doing?
Great, thank you for joining us today.
My pleasure.
It's my privilege to introduce Dr. Davis. He brings a wealth of experience, 25 years as both an executive and a practicing clinical psychologist. We're so pleased to have you today. And with that, I'm going to turn it over to you, CJ.
Thank you. Yeah, thank you so much for SBJ for holding this event. I want to thank, I'm looking down now at my screen to the over 300 people that are joining us. It's always an honor to talk about behavioral health related matters, especially in a world whereby behavioral health is not always the topic of choice to conversation. So the fact that our communities continue to have conversations regarding behavioral health and the importance of behavioral health, especially now, during this COVID crisis, is extremely important. So right now, if we were to look at where we are as not only our viewing area, but of Americans, is that at the present state, we have about 35% of people that are concerned about their behavioral health. And that's up literally over a few weeks up from 22%. And actually what we think in the mental health community is that actually somewhere in the neighborhood of 50% of us presently are concerned about our behavioral health and how we feel. And that, to put it in perspective, that's 1 out of 2 of us. And I think that that's really important as we all are dealing with a situation that we feel a fear and frustration. And we're really addressing what we call in the behavioral health industry a fight or flight reaction. And what that basically means is that when we experience stress, we can our body prepares to defend ourselves and we will fight through that. And we're all hardwired to be able to deal with stress in this particular way, or that we run or we flight. And unfortunately, what's happened is that when these stressors are always present and constantly on your mind, your body and your mind feels under attack. And the long-term activation of this stress response has damaging effects on the mental health of most individuals. And in fact, if you stay in this constant state of fight, of this preparedness, then what we found is that many people are at risk for additional health problems, including anxiety, depression, digestive problems, headaches, heart disease, sleep problems, weight gain, and memory and concentration issues. It's very similar to if you had a fear of flying and somebody put you on an airplane every day. And that's really where we are right now with the COVID virus. We are in a constant state of fear. We are in a constant state of panic. And at times what happens is our bodies are starting to break down. And I think that that's really important for everybody as we're going through this today to really start to examine what your symptoms that you're having. I know that I'm going to be speaking to a lot of individuals that are listening in. Of course, I'm going to talk a little bit about mental health factors, but I also know a lot of employers are listening in today. And I'm going to talk about some things you should think about in the workplace as well, as we all try to get through this fight or flight response that our bodies are presently experiencing. One of the things I want to mention is, why are things feeling worse from a mental health, state of mental health perspective right now? We are hearing every single day the importance of social distancing. And I really want to make sure that I state up front that social distancing does not equal social isolation. I want to make sure that everybody sort of, if there's a take-home point from today, that we understand that we should not be isolating. We instead would rather use the word of physical distancing while emotionally connecting. And why is, I think I just lost the PowerPoint. There we go. So the next slide, please. So why is isolation, why are we focusing on physical distancing? Well, isolation is a really interesting psychological variable, and one that we want to make sure that we're covering today, because isolation impacts a whole host of psychological factors that load into mental health conditions. Let me give you a few examples. When you live in isolation and you lack the constant human connectedness and constant human relationship, you start to feel a sense of hopelessness and helplessness. And during a period of time where we already feel like the world is we're living in an unpredictable and unsafe place, we don't want to experience additional hopelessness and helplessness. We know that hopelessness and helplessness loads very heavily on depression. If you look at the literature on depression, that's one of the #1 factors that loads on somebody experiencing a depressive condition. We also know that isolation leads to interpersonal loss and loneliness. If you've seen any data out on social media, we know that the United States is a country that lives in a fairly high state of loneliness. Now, if we were looking at depression and we are also looking at suicide and suicidal ideations, interpersonal loss and loneliness are two really critical factors that can impact somebody considering suicide as an option or somebody that's going to continue to feel depressed mood. So let me tell you just a little bit about putting this in perspective as I talk about the current mental state of our mental health, is that before COVID-19, the mental health system was already experiencing a crisis. And the crisis really has been around our ability, our system's ability, not necessarily rural behavioral health, but our country's ability to service the increasing demand that are coming through our doors for folks interested in care. And that's often evidenced by, unfortunately, the long wait times that many communities have to experience to get into care. But prior to COVID, suicide has been climbing. And in fact, right here in Greene County, we know that suicide is higher in Greene County than any other county in the state of Missouri on average, and it's higher than the national average for suicide. We also know that suicide is the #2 cause of death for adolescents. So you can think about the moment in time with your kids that are at home. They're often unsupervised and they're isolating and they're feeling helpless and hopeless. We want to make sure that one crisis doesn't lead to another crisis when it comes to suicide. We also know that over 17 million Americans presently experience a depressed condition. And unfortunately, 80% of those Americans who need care for behavioral services don't seek care. And that people that right now we're experiencing a tremendous amount of isolation from others. And unfortunately, what happens during the pandemic is people begin isolating from care. And we found that actually when we look at the research associated with other pandemic outbreaks, for example, if you look at SARS, you look at natural disasters, you look at 9/11, there's a period of time in which people actually engaged naturally in more social isolation than during normal kind of business as usual times. We also know that this loneliness has been linked to addictions and substance abuse. We're seeing a tremendous amount of caffeine intake in the morning and an increase, and we're seeing an increase in alcohol sales and substance abuse in the evening. And of course, that that contributes to sleep deprivation and a whole host of other risk factors that are really contributing to additional mental health concerns. So the current state right now, since COVID-19, our organization has seen a tremendous increase in the number of people that need care. anywhere from 10 to 15%, and that seems to be growing every single day. If you look nationally, what we found is there's about 65% more people seeking online therapy right now than really ever before, and that's really month over month, the increase since the COVID. We also found that app-based treatment has seen an increase in 50% increase in new users. When you look at programs like MyStrength, which you can actually utilize on our website, it is a free app with education about mental health. But another app is called 7 Cups, which allows you to chat with listeners. We have found use of both of those apps and programs are continuing to increase. We're seeing that insurance carriers are beginning to waive copays during COVID to ensure that people remain in care. And we've also seen some privacy restrictions as a result of the COVID that have been reduced, that have heavily burdened the mental health industry. We can now provide some services over email. We can provide services even over telephone. And so that individuals that need care right now can actually seek care from the comfort of the home. And that's going to be really important as I move into the next few slides. All of us fit into right now one of 4 groups. The first group is what I call A-COVID. And that is truly just the anxiety of COVID, which I would say 9 out of 10 of every single American and every single person in our area experiences some anxiety of COVID. And what do I mean by that? It's not necessarily a diagnosable generalized anxiety disorder or something that would require medication, but it is those simple things that we are constantly anticipating the worst, that we live in a state of fear. If we live in a state that we're going to get infected, we're living in a state that we're worried that we're going to take home an infection to loved ones, and it just always sort of weighs on our mind. The second group of folks is COVID with pre-existing mental health diagnoses. And so what that is somebody that has a current mental health diagnosis, and they're suffering from increased anxiety and sometimes what's called agoraphobia, or fear of leaving their home, on top of the typical factors and anxiety associated with COVID. And then we have quarantined individuals. Those individuals are quarantined because they've either come in contact with an individual that's been tested positive for COVID, or a quarantined individual that actually has a positive test of COVID. And both of those groups we know live in high amounts of anxiety, high amounts of frustration, and high amounts of depressive symptomatology. And then the fourth group we have are frontline workers, folks that are truly on the front lines, interacting every single day with individuals that are diagnosed with COVID. And that group, of course, experiences a whole host of different problems. They experience what we call in the mental health field secondary traumatic stress as a result of subjecting themselves to what they would perceive and we would perceive as life-threatening situations each and every day. And so those are the 4 groups, and I feel confident that all of us fit into one of those 4 groups. So what I keep saying publicly is that we don't want one public health crisis to lead to another public health crisis. And right now, if you see on your screen, we have the flatten the curve principles that we've been beautifully pushing. Our health department, local leaders have been beautifully pushing as we try to flatten the curve with our protective measures, which really are physical distancing. And we can see that the healthcare system, if we're able to flatten that curve, 2 things happen. Hopefully we save lives, but secondarily, we make sure that the hospital systems do not exceed capacity in their abilities to treat folks that are infected. Now, the second curve is the blue curve, turquoise curve, is really the existing mental health crisis. And so please note that already we have a situation where our demand on a day in and day basis has pretty much taxed the mental health system to the point in time that people have to wait a long time for services. So that's already an existing mental health crisis that I mentioned. And then what we have there is the next slide. It shows you a little bit about how with the additional COVID, how that we are waiting for what we call the mental health crisis surge that will occur as a result of the COVID crisis, which is going to be really important in a second when I talk about things that you need to do that are a little bit different than normal. But you also know that the additional increase in demand will far exceed the healthcare system's capacity to treat. And we also know that as a result of this social isolation and fear and panic, that fight or flight response that I mentioned earlier, the prolonged amount of time that we're experiencing stress and anxiety, there will be people that end up having a clinical anxiety or what we call clinical depression that previously did not, as a result of everything that's happening. And what we know is that this, for when we deal with a pandemic or a life-threatening disease, the thing that is probably most fearful for the mental health community is that we see that these symptoms generally last for about 1 to 3 years post the disease outbreak. In other words, people continue to live in anxiety. People have symptoms that are very similar to post-traumatic stress disorder and very similar to natural disasters. And it takes a long time for a society to recover from those mental health demands. And so we really want to make sure that we are flattening the mental health crisis curve that's coming next. So how do we work together really to flatten this curve? Well, think about it. Every day that you go into work, you have a group of people in your work circle that check in on you. How are you doing? How was your weekend? What did you do this past weekend? And now all of a sudden, just like kids that are absent of school, adults are absent from work. And what we've lost is the ability to regularly check in with each other. And there's a really great way to make sure that people are ahead of symptoms. And so normally you wouldn't recommend somebody to reach out to a professional. My encouragement right now to everybody listening is that we have to check in with each other to the point in time that you're asking people if they're not just okay, but if they're experiencing any symptoms that would lead you to believe that they could benefit from talking to somebody. So I just want everybody right now to even think, just take your own personal inventory to truly think about how you're feeling. Think about some of the feelings and fears and anxieties that you have, or think about some of the anxieties that your friends are experiencing when you talk to them, hopefully by phone or some sort of social media. We need to encourage all of our friends and employees and colleagues to not only reach out to each other, but we have to encourage them to engage in care. Now, some people say to themselves, you know, CJ, I'm not a therapist. I'm not a professional. What can I do if they're saying something that I'm concerned about? There's a thing called QPR. The first thing you do is question people. Make sure we're asking more questions of each other than normal. The second thing is persuade them to engage in care. And then the third thing is to refer them to care. And I'm going to talk about the referral part in a minute. The other group of people that I want to encourage that are folks that are already receiving behavioral health services or healthcare services, those people need to remain in care. We know during this difficult time that it's very easy, because we are isolating, that we disengage from treatment. So if you know somebody that's in care, you got to encourage them to remain in care. So one of the things that we've received more calls on lately is, you know, what can employers do? The first thing I think is really important to mention is the fact that this is a real opportunity to form your culture. And this is an opportunity to show a workforce that you dramatically care about them. Mark Cuban was out front of this probably about 3 weeks or so ago and said, every company truly has an opportunity in front of them to show their staff how they care about them. And so what are some things that we're finding that are important in the workforce for employees that are either working remotely, or the ones that are even working as a result of being an essential worker? First thing is connect regularly. And of course, that's a theme that you continue to hear me say, connect regularly. You know, we had a conference call the other day at BeWel, and before we started that call, we had about 20 people in the room, and we went around the room and had everybody check in on a scale of 1 to 5. 5 being you're really happy, and 1 being you're struggling today, just to check in, just to establish a baseline so that if there's somebody in your organization that needs something, that you can follow up. And from a remote worker, establishing a check-in protocol is really important for your leaders. You can do you can engage a lot of different practices around this. One of the things that we encourage is 3 simple questions. How are you doing? What are your struggles and challenges, and how can I help? I think establishing a formal protocol with your people that are working remotely is important. We've mentioned and pushed EAP services. Make sure you have EAP services available and ready. Those are behavioral health services that even could be utilized over the phone. The last thing is to create a BeWel community. And let me tell you a little bit about what we do. We create a conference call. Actually, it's a Zoom message and meeting every single day at noon, where we have all of our staff have the ability to Zoom in to a place where they feel like that they're getting taken care of, where they have the ability to check in, where they do some meditation and deep breathing, do a lot of things that we're very familiar with in the psychological community, but not necessarily in the regular workplace. And it's been very, very well received. In fact, we've had nearly 300 plus people call into these things every single day, and we've been doing them 2 weeks. You can join us on Facebook if you want to see what a BeWel community is like, but we encourage, again, this is an opportunity to embrace your workforce as they are experiencing mental health symptoms, and they fit into one of those 4 groups that I mentioned earlier. The other thing is the more information, the better. I think that the more information that you can push right now is more important than ever. And during a time of unpredictability and during the time of misinformation and not enough information, as an employer, it's extremely important and highly recommended that you get in front of that and provide as much information to your workforce as possible. So another popular question is, what are the symptoms really, CJ, to look for? And how do we make sure that these symptoms don't really manifest into a true anxiety condition or a true depressive condition? And I'm going to run through some of these. They're psychology, a little bit psychology 101, but they're all extremely important because these are all the hallmarking symptoms for you to be on the alert for people that you either work with or people that are a part of your workforce and you lead. One of those, of course, is difficulty concentrating. And of course, that will impact job performance. But the very first thing that happens for folks who experience anxiety is they have a lot on our mind. We all have a lot on our mind right now. And staying focused is something that's very difficult. It's often the very first symptom of developing anxiety and depression. It's around concentration. Fatigue and sleep disturbances. Waking up in the middle of the night, we're having a hard time falling asleep. Those are the 2 symptoms that I think are important for everybody to monitor, which is really important for us to think about the screen time and the social media. Lots of social media or lots of screen time prior to bed is not a good idea. We always recommend people turn off their social media and TV about 1 hour before bedtime. This is important, especially important for children and adolescents, as we all experience some sleep deprivation right now. And if you can stay on a normal bed routine, I think that's really important. Even in my house, we tend to been watching more Netflix in the evening time, and my sleep-wake schedule is a little bit different now as a result of being home and my family home. And so I have to pay attention to my own sleep-wake, my sleep-wake cycle. Paranoia and fear, and this is where we start to think the worst. And this is the one that I think as you look at pandemic outbreaks, if you look at, for example, in Toronto, I mentioned earlier that 1 to 3 year mark, this is the place that people really start to experience a symptom that is very bothersome. Everything they touch, they have to put hand sanitizer on, or every single place they go, they're worried that this will be the place that they actually contract the disease. And so it can create this paranoia and fear. Irritability and moodiness, clearly that's probably speaks for itself. Obviously, these symptoms are going to manifest in high and low job performances. I really encourage the workplace and employers right now to have some flexibility on job performances. Excuse me, I've already talked about general worry and apprehension. And the last is The last symptom is really thinking about the worst. And this is where all this anxiety and fear can impact us on a term what's called catastrophic thinking. During moments like this, we all have tendencies to think the worst. Like we think catastrophic, like my whole family is going to die. I will go into the hospital tomorrow. And the way in which we pay attention to those catastrophic thoughts are extremely important as we're trying to manage social distancing and social isolation. I want to remind everybody of two things. We have a 24-hour crisis line. We've had one for a long, long time, many years. And I think that's important to mention always, and please take that number down. But the other thing I really want to make sure that I mention is it's been pretty exciting for us in the mental health industry that the state of Missouri has permitted us to be able to provide telephonic services. Now we can do telehealth services, but we can also do truly phone services. So the access to mental health services right now has never been easier. And if you know of somebody who's struggling and you know that they could benefit from just talking to somebody, we have the ability to provide care over the telephone. You can see a doctor, you can see a therapist. And in fact, if a doctor recommends a medication, although medication is a small part of what we do, if a doctor in fact recommended a medication, there are also instances where we can even have medications delivered to your home. And this again is one of those strategic endeavors that the Community Mental Health Center system in the state has deployed in an effort to flatten that curve. And we really want to get ahead of that crisis surge that's going to happen. And one way that we do that is through the use of telephone appointments. And I think I was instructed to talk for about 25 minutes, and I'm at 26 minutes. So forgive me for being 1 minute over, but I think at this particular point in time, I think I can do some questions, right?
Absolutely, and we appreciate everything that you've given us so far. There have been a few questions that came in while you were talking. One was that with these brief check-ins that we're having as we're all working remotely, people tend to put on their best face, you know, by telephone, by social media. How can we recognize the signs that somebody's in trouble with check-ins being what they are right now?
Yeah, really great question. And there's a saying in our industry, and we probably should push it and share it more. And really it's okay to not be okay. And I think that's really what we have to talk about with our kids and our friends. And I think at the beginning when I talked about, we all really fall into one of those four buckets. I've not met anyone really in our community that I associate with is not impacted by this in some way psychologically. And we have to push to each other. Another great idea for employers is to make sure that they know it's okay to not feel okay.
Absolutely. Do you have any specific suggestions on what an employer can do to help an employee that's struggling prior to leading them to outside help?
Yeah, I mean, if you have a EAP, of course, that's a really important first step. But I think it's about creating a culture where check-ins are so regular that you're promoting to the workforce that checking in on how you're feeling is just sort of the day-to-day thing. It's no different than getting that cup of coffee. It's no different than scheduling a new meeting. It's no different than emailing. That it's just a part of the fabric of the culture in which you are employed. And that I think what happens is that there's such a desire for that right now across people to talk about it, holding opportunities to do that. I know that one employer, as an example, created some support groups. And sometimes people don't necessarily like the term support group, or maybe there's a negative connotation to that, but have the ability to say, okay, at noon today, we're just going to hold a check-in, or noon today, we're having a coffee check-in, or whatever the scenario would be, so that you creatively create an environment whereby the employer sets the stage. If you do that, I really believe that the workforce will follow.
Sure. One question that came up was some people are experiencing their providers have disappeared. You know, offices are closed. They don't know how to reach their regular provider. Is anyone welcome to use the numbers that you provided earlier, or what do you suggest for those folks that there's been an interruption in the care that they were used to?
Yeah, I hate to hear that care's been interrupted and an opportunity's been taken away. Yeah, anybody can call the numbers that we've provided, especially if there's a crisis, but also to really engage in care. You know, from my agency's perspective, we are the safety net provider in our community. We will never close our locations. We will always be available regardless what happens. So anybody can lean in and lean on Borough Behavioral Health. And so those numbers will always be somebody available for care. And right now, excuse me, given the fact that we have the ability to offer telephonic care, the wait times are extremely low. So normally when you walk into a walk-in center, we have a 24, not 24/7, but we have a daily walk-in clinic that you can walk in at any time and receive care. The telephone would be very similar. You could call in, schedule an appointment, talk to somebody immediately, so we're there.
Great to know. Earlier in the presentation, you mentioned some of the symptoms or things that might occur from anxiety, such as weight gain and sleeplessness. There was a question that came in asking if somebody is already recovering from a disorder like this, what would you suggest they do to avoid some of those additional problems from occurring?
Yeah, you know, there's going to have to be a fair share of folks doing some things on their own. You know, I mentioned the apps. There's lots of education out there. You can get on our website and engage in an app called My Strength that gives you plenty of psychoeducation about what's going on. I really believe engaging in some meditation and relaxation techniques that you can learn about on, for example, on the website. Making sure that you're regularly connecting to people, ensuring that you're minimizing your news and social media, minimizing the use of substances. The other thing I think I've found that people have really started to engage in, which is an older sort of intervention in the mental health world, but doing a lot of mood journals where you are monitoring how you feel and monitoring each day what was going on. So you can start to really track and understand what kind of trends are happening with you and why you're feeling certain ways and when.
Great. Dr. Davis, are there things that you're aware of that we should be looking for in our health insurance plans to know whether or not or what types of mental health services are covered?
Yeah, you know, they've passed what's called, and this has been years ago, and some insurance payers haven't necessarily jumped on board with this, but there's a thing called mental health parity. And we believe, of course, mental health is healthcare, and that we believe strongly that payers should engage in equity around what you need from a physical perspective and really what you need from a mental health perspective. And so we have found that even from a telephonic perspective, most payers are allowing telephone services. And a lot of payers right now through the COVID crisis are actually going to be waiving copays. I don't have a list of which ones those include, but I do know that that is the case across multiple payers. So I think the first thing I would do if I were a person seeking care and Borough wasn't an option, I would reach out to my insurance company and see what is my insurance company doing right now during the crisis to make sure that I either engage in care or remain in care.
Okay. I know I'm skipping around a little bit, but we had several questions come in from folks who have children at home during this time, both college students and children who are now taking their classes at home, and also educators, wondering what things that they can do to help their children.
Yeah, you know, it's a tough time. I was just visiting with a coworker talking about how this individual's kids were starting to struggle a little bit because of the prolonged physical distancing. And we get so many needs met from interpersonal relationships and rewards from those relationships outside the home. And just now dramatically, those things are cut off from us. And so how do we kind of replace those naturally occurring reinforcers that kids get and find ways to provide them in the home? Number one thing is to keep your kids on a schedule, you know, and I know that that's really hard when everybody's struggling with current anxiety levels, but, you know, actually putting out a daily routine and put that daily routine on the refrigerator, post it somewhere in your home. help your kids establish that daily routine with a mixture of chores and schoolwork and some physical activity. Make sure that they're not sitting around, and then find ways to reinforce them. I talked to a parent the other day that said that, what they're doing is a sort of a job chart with stickers. Every time they finish a job, they get a little reinforcer with a sticker, and the kid tracks it on the refrigerator. So we are forced now, parents are forced to be a little creative around how to manage our kids for such a prolonged amount of time. And it's not just about keeping them busy. It's about trying to replicate those reinforcement mechanisms and structures that they receive in the outside world, namely school, replicate those in the home. The other thing is truly make sure, when we're talking about schedule, make sure that they stay on the same sleeping and same eating schedule. That's really, really important. Sleep deprivation right now is something that many Americans are struggling with. And just to remind people that a 10-year-old child should have around 10 and a half hours of sleep. So up to about 10 is about, you should have somewhere around 10 and a half hours of sleep. So if our kids were already functioning sort of at this crisis of sleep, and now during the COVID crisis, when parents are up and are catching the latest news, the kids are staying up later too. And I think keeping them on the same bedtime rituals were important.
Sure. As an employer, I'm aware of a great deal of funding that has come online now to help us with paycheck protection, to help us as employees may be impacted by illness and having paid sick leave. Are you aware of any funding that has come online to assist with the mental health crisis as it relates to COVID?
Yeah, there is a slew of funding coming down the pike. Funding for mental health related services are no different than the funding associated with, for example, Small Business Association. We hear the funding's coming. We don't really know the particulars of that funding. My anticipation is that Borough, as a state designated community mental health center, we will continue to get disaster funds in order to treat people. At this particular point in time, we are not denying people service regardless of their ability to pay. That's actually a part of what we do every single day, by the way. But our job is to make sure people engage in care and receive care. And we have payment policies, and we make sure that, again, no matter your ability to pay or not, you can start with us and we can help people figure it out.
Would you have anything to say just about the stigma surrounding a positive COVID test, and how employers ought to be communicating about that with employees, or employees communicating with coworkers?
Yeah, we're all going to experience that sooner or later. And it's really interesting. There's some great research out of the University of Nebraska that talks about that very thing, about how is it when somebody's been quarantined and sick and has had a positive diagnosis, how is it they re-enter the world? And what they found is that probably the biggest concern outside of anxiety of getting infected again is the anxiety of being accepted back into their social circles. You found, again, for about a year after somebody's been diagnosed, they've been stigmatized. That is, hey, we don't want to be around CJ. He's had that positive test. And there's dramatic consequences of depression in folks that get the diagnosis, unfortunately. And so as an employer, what you need to do is do some pre-education starting now about sending things out to your workforce, about how is it that you welcome people back into their respective roles. I think that's really important. We've been messaging our workforce that we will have people diagnosed. And even in the behavioral health industry, there will be people that continue to be stigmatized. And I think the organization has to set the tone and has to set the stage by messaging as to what will we do, or what will we do departmentally, or what will leaders do when folks have a positive test, are sick, and return well. How is it that we reintegrate them? I read an article the other day that was talking about, reintegrating prisoners into the world. How is it that we integrate folks that have been quarantined and had a positive corona test into the world? And there's some similarities there. Obviously, lots of family support and lots of prepping them before they even move into the integration process. hopefully one of the things that we are going to do is to create some groups, even over the phone, where you have the ability, if you have a positive test, that we connect you with other people that potentially have a positive test. Of course, you have to work out some privacy related issues, but we want to find ways to create support systems for positively tested individuals.
One of the most interesting questions I think that came in is related to care of the caretaker. You know, with this COVID epidemic, there's been so much more demand on providers, and we're wondering what BeWel and other providers are doing to manage the stress of the mental health provider.
For the frontline workers, you mean, what are we doing for our frontline workers?
And what can our viewers do as well to help frontline workers?
Yeah, I mean, I've been so impressed with our communities about how we've really pulled together to support our frontline workers and those caretakers right now. You know, many of those folks are so mission driven and so committed to care, including the people that work for our organization. It's a calling and a privilege and an honor to be in the healthcare related industry. And so anything that you see on Twitter, cards, emails, text, all of those things help. What we normally would do is we would reach out, go visit them, connect with them. And now what we're resigned to do is to really make sure that we connect them in creative ways. There will be continued stress reactions in those frontline workers, like I said, for a year to 3 years. And so my real encouragement message would be is not only support them now, not to support them 2 months from now, but be supporting them in the next 2 or 3 years, because they are the individuals that are taking a brunt of the anxiety and trauma that will be long lasting over time.
Sure. I continue to get several questions here related to the phone lines that you talked about earlier in the presentation. Can you talk a little bit more about that? One of the questions is that care open to somebody when it's not considered a crisis situation?
Correct.
They
Yes.
just need ongoing care and it's not crisis. And then also, is that open to anyone even if they're not currently covered under health insurance or outside of the BeWel typical coverage area?
Yeah, no, right now what we're doing that for are people that are in our respective responsible communities and area, which would be 7 counties surrounding Springfield and 10 counties surrounding Columbia, Missouri. Those folks were technically responsible for their mental health and well-being. So the 2 phone lines, one is for the crisis line. That's truly if there is an urgent or emergent situation where you know of an individual that is at danger of hurting themselves or somebody else, or has the threat of being hospitalized for some sort of psychiatric issue. And then the other number that was posted early was a number for individuals that are just open to care. And at that point in time, I would encourage everybody to call that number, and that our goal is to make sure that anybody's that reaching out to us, that we are able to engage them in some sort of service.
Thank you. We're about at the conclusion of our webcast. The most frequent question I received today was, will this webcast be posted somewhere? So CJ, with your permission, I'd ask that we could include this webcast and your PowerPoint and make it available to those that couldn't watch today or that have additional questions.
Yeah, we'd be happy to allow that to occur. We will hope that the message today helps somebody out there that you know, and if it means one person engaged in care or remained in care, then that's one step closer to flattening the curve. So we'd be happy to do that.
Wonderful, thank you. I want to thank you for spending some time with us this afternoon. I also want to thank our 450 registrants for being a part of this webcast. I hope that you will look for other webcasts like this from SBJ Studios in the future. Thank you so much, CJ, and thank you to our viewers.
Thank you. Be well.